Is med school hard? Do you have to be super intelligent to survive? And should you go to medical school? Now, these are some questions that you might be interested in if you're an aspiring medic or you're generally just curious. And if that describes you, then you're in the right place. In this video, we'll be going over 6 different questions asked on Reddit for medical students, answered by a medical student. And if you're new here, hi, I'm Ishan. I'm a medical student studying in London. So let's go straight to the first question. Is med school doable? And while answering this question, we can go into how hard it is it possible to have balance, and what's it really like? So in my opinion, med school is definitely doable as long as you have 2 main features. The first feature is you are willing to put in hard work. And the second feature is you actually like talking to people. Now, the thing about medical school is it's a degree with extra bits added to it. The degree bit is all about learning facts and information and making sure you can memorize a load of information while also understanding really complicated concepts. So you have to be able to work hard and actually understand what's going on and be interested in the scientific topic. And overall, that just requires quite a lot of hard work. But secondly, and most importantly, if you don't like talking to people, then medicine is probably not for you. Now, of course, even with other degrees, you might be placed in jobs where you have to speak with people, but in medicine, it is a requirement if you want to become a doctor. More often than not, as you progress through medical school, you're asked to speak to patients, improve your communication skills, and overall interact with a lot of different people. So if people aren't your thing or you prefer to just sit behind a desk for your job, then maybe medicine and medical school might not be for you. Now, secondly, when thinking about medical school and whether it's doable, is balance. And I definitely think it's possible to have a good work-life balance as long as you prioritize it. Now, of course, during exam season, your work-life balance will look very different to how it looks at the start of term. But as long as you work out what your priorities are, say you want to play tennis twice a week, then you can definitely fit that in as long as you work around it. And of course, as it goes with anything that's worth doing, you will have to make sacrifices, but I promise it will be worth it, and you can still maintain a decent work-life balance, especially during most of the term time. Okay, so now moving on to the next question, is medical school just rote memorization? Now, this is a really interesting question, and I don't think it's talked about enough. Medical school does require a lot of memorization techniques, and you have to be good at memorizing because there's a lot of anatomy, different words and names that you have to understand and memorize in order to pass the exams. Now, this is important because you need to understand where things are in relation to other things and overall speak the same language as all the doctors so that you can effectively and quickly communicate what's going on. But what's good about the memorization of words is it's not always just memorization. A lot of these times, these words are derived from Latin etymology. So if you go back and figure out what the meaning or sub-meaning of the words are, you can start to work out patterns in the words that you're using. So if you're tactical about it, you can start to reduce the amount of memorization and increase the amount of understanding and pattern recognition. But that said, there's a lot of memorization beyond that, not just in memorizing facts, but also memorizing procedures and how to do different clinical examinations. But with that kind of memorization, it does boil down completely to practice, and you can do that as long as you study enough and work hard. Now, what I've described about memorization is just a small section of the amount of information we have to learn. And if you're not good at memorizing, you can rely on pattern recognition, flowcharts, or general understanding from first principles thinking so that you can understand the topic and you don't need to memorize. All right, the next question links on very nicely. Do you think medical school is more about working hard or pure intelligence? Now, my opinion is the most cliche answer ever, which is it has to be a bit of both. But as I said before, with the amount of information you have to understand or memorize at medical school, hard work will always beat intelligence. So if you think you're more on the hard working side than the intelligence side, then definitely consider going to medical school. If you're more on the intelligence side than the hard working side, you can stay intelligent and that will help you, but you will also have to use your hard work to actually survive at medical school. But also, I do believe that that drive to work hard is a muscle that you build over time, and medical school definitely helps with that. So for me personally, I didn't work as many hours before medical school compared to what I can work now, but it is definitely an ability that can be built with time. So don't think that because you're not used to working hard or you're not super intelligent that you're not built for medical school, because those are both skills that you can learn. All right, our next question is quite interesting, which is why should I not go to medical school? Now, I think this one links back to the thing I said at the start of this video, which is the 2 traits you need if you want to go to medical school and survive at medical school, which, to remind you, are the ability to work hard. Even if it's not super hard at the moment, you should still be willing to work. And secondly, it's the ability to speak and be interested in speaking to people. But beyond that, I think there are more reasons why some people might want to go to medical school, which may not be the perfect reasons to do so. For example, if you're in the UK and you're going to medical school for the sake of money, then you're not going to see much money as a doctor for quite a while. Now, the second reason is if you're doing this just for status or to tell people that you go to medical school or that you're a doctor. Remember, you are living this life every single day, every single hour for a lot of time. So I don't think the payoff of telling people that you're a doctor or telling people that you're a medical student is sufficient to justify the amount of work that you're going to have to put in. And beyond that, most of us have the aim of becoming a good doctor. So if you're not there to become a doctor, or you're not interested in that pathway in the first place, then maybe medical school isn't the best choice and something else might actually accelerate your career much more. But if you are in a situation where you're not sure whether medical school's for you, or you have some dilemma, then definitely chuck it in the comments below or DM me on Instagram and I'll try my best to help you out. All right, here's our penultimate question now. How did medical school humble you? Now, I've had quite a think about this one, but I do think I have an interesting story about it. So essentially, there's a saying in medicine which is see one, do one, teach one. Now, of course, I'd read about this in books and I'd heard about it, but I didn't appreciate how much it's actually used in medical teaching. So I organized myself this taster week in orthopedic surgery. And on one of the days, I'm in the fracture clinic. So patients who've had a fracture are coming back just to get examined by the doctor, make sure they're healing okay. And to give context, I'm a second year medical student at the time. All I've been doing is lectures and Anki and notes. And now I've been thrown into a hospital which I've never seen before. So this early on, we hadn't been told how to take a patient history. So the doctor was like, don't worry, let me teach you. So we go into a room where there's a patient with their family. So the doctor tells me to sit down, sits down next to me and starts explaining each step of how to take a history. So I was like, that's great. Now I'm going to be able to see how he does it. Instead, he was like, okay, you know how to do it now. Just take the history. And left the room. And I panicked because I was like, I have no idea what I'm doing. But I trudged through it, I tried my best. I don't think I did a great job, but the patient literally had to help me take their own history. But I learned a massive lesson from it. I was just thrown so far into the deep end that I just learned so quickly after that the next few histories just became much, much smoother. But although it was a humbling experience, it most definitely taught me that one of the best ways to learn is just to throw yourself into a situation, fail a bunch of times, and get better. So now I can expand on that a little bit more for this final question, which is, what has being a medical student taught you? Now, I truly believe that being a medical student has taught me so much, but it also comes with just 3 more years of experience in such a new environment at university. So I'm going to try and differentiate my answer from things that I would have just generally learned from uni life and make them specific to medical school. I think one thing that medical school has most definitely taught me is the power of people skills. If you're kind, interesting, and empathetic, you can thrive so much at medical school because those are the exact traits that are rewarded. For example, if you want a research experience with a doctor, all you have to do is show interest, go hang out with them in theatre or in the wards, and then ask for the research experience after that. And if you show that initiative, you will be rewarded. And also from the limited number of patients I've spoken to, I've learned so much about their life experiences and generally how life's not just all about work. Honestly, medical school's been such a brilliant experience so far, and it's taught me so much I could probably make a standalone video about it. But the 2 things I mentioned just now are definitely things that I believe are specific to medical school and also just big life lessons that I will take with me. So I'm not sure if this video has convinced you to go to medical school or not, but most importantly, I hope that this gives you some perspective on what life as a medical student is like. If you have any other questions about medical school, then definitely leave them in the comments and leave a like on this video below if you found it enjoyable. Otherwise, I'll see you in the next one.